Have you used Narcan to reverse an overdose?
At the Weber Human Services building in Ogden,
So we'll put no.
this vending machine spits out a lot more than an afternoon sugar fix.
We have the naloxone, we have boost shakes, socks, we have fentanyl test strips, some packets that contain resources.
David Sekulich is a prevention specialist with Weber Human Services. He's been advocating for vending machines as a tool for helping prevent drug overdoses for years.
So about 4 or 5 years ago, I had seen a couple places across the country started doing it and was really interested in it. Tried to push the initiative back then and kind of met with a little more opposition in our county.
Now, 10 machines across the county vend these supplies to the public, free of charge.
I think people understanding that this opioid epidemic is a serious thing and wanting to help save people has kind of pushed a shift in that.
Sekulich says naloxone, the opioid overdose reversal drug, is the most popular item. But he says fentanyl test strips, which allow someone to easily see whether the deadly synthetic opioid is in their drug supply, has proven popular as well.
I mean, if I had to guess, I would say 500 test kits, probably more. Yeah, we go through a lot at some of the locations.
The vending machines and the test kits are part of a public health approach known as harm reduction, which works to reduce the negative impacts of behaviors like drug use.
I think harm reduction is, again, taking people where they're at and providing them these tools, and they eventually, on this spectrum, might choose abstinence and might stop using drugs.
Tricia Bishop is the overdose prevention coordinator with the Utah Health Department. She oversees harm reduction groups in her role and says research shows tools like test strips help change behavior, reduce overdoses and disease transmission, and get people connected to the help they need.
Somebody who uses some of our overdose prevention services, some of our syringe exchange programs, our harm reduction programs, they're 5 times more likely to get into treatment.
A recent report on fentanyl highlighted the effectiveness of harm reduction in Utah. It found that when those services decreased in the state, deaths went up. Do you see the fentanyl test strips as an important part of addressing the fentanyl crisis and reducing death?
Yes, I do think it is an important tool to have in your toolbox.
But the approach can be controversial among those who see it as a way of enabling or promoting drug use. Last July, President Donald Trump signed an executive order that says harm reduction efforts facilitate illegal drug use and its attendant harm. Then in April, the federal government announced a crackdown on distribution of fentanyl test strips, saying they can no longer be paid for with federal dollars.
Currently, we have a supply that we should be able to work with for the next 6 months to a year.
Of test strips?
Of test strips, yes. Fingers crossed. After that, though, we do not have the funding, the federal funding that we will need to continue purchasing these.
Bishop's office relies entirely on federal dollars. It has historically used some of those funds to purchase test strips for local health departments and harm reduction groups to distribute. Are you concerned that this is going, people are going to have a hard time finding these resources in the community at some point, and will that make an impact?
I am, and I do think that we need to bring a little more light to this, and I do hope that one, our programs do think a little bit outside the box, and try to figure out other funding sources.
Bishop hopes to see state legislators allocate funds for test strips in the future.
And did you want some kits too?
Sure, that'll work.
And says that in the meantime, harm reduction groups will have to look for other ways to fund them.
If we get a similar definition of what we mean by harm reduction, I'm always blown away by how many times people will say, like, oh, that makes a lot of sense. Like, I wish something like this had been there when my son passed away from an overdose.
Mackenzie Bray is the executive director of the Salt Lake Harm Reduction Project, a group that expects to be impacted by the new federal guidance on test strips. She says harm reduction services have historically faced initial pushback, but believes the public has become more comfortable with tools like naloxone in recent years. And she hopes fentanyl test strips will follow a similar pattern.
So really the goal is like preventing overdoses as much as possible and just giving people information so that they can, choose to discard the supply or just make like an informed choice.
She told us the group will look for ways to continue providing fentanyl test strips to the community, but may be able to afford fewer now. As for the vending machines here in Weber County, they're funded through a private grant, which means they're unlikely to be impacted by changing federal guidance.
We have ongoing funding for the products in the machines, so I don't imagine it ever stopping.
As harm reduction faces national scrutiny, Sekulich says the response in Weber County has been overwhelmingly positive. He believes the community understands that the resources in these vending machines, including the fentanyl test kits, may just save a life.
If they have an opportunity to test it, I hear all the time you can't get treatment or recovery if you're not here. So
in Ogden,
keeping people alive long enough to
Taylor Stevens,
get into treatment when they're ready, I think that's
Fox 13 News,
a huge testament to fentanyl test strips.
Utah.